Welcome to the Beauty Equation podcast, where beauty meets biology, psychology, and art history. This podcast is hosted by myself, Dr. Christelle Oliver-Dussault, Dr. Harpreet Lotay, and a beauty industry expert, Amanda Manholt. This is your space to reclaim agency over aging and beauty on your terms. We're cutting through the noise with evidence-based insights and real talk about aging, self-perception, and modern treatments. No quick fixes, no fluff. Just honest conversations to empower you to define beauty for yourself.
Welcome to the Beauty Equation. By the time women get to this point, noticing change, trying to understand it, something else often creeps in. Urgency. The pressure to do something. The feeling that if you don't act now, you have missed your chance. And here's what we see over and over again. Regret doesn't come from choosing the wrong treatment. It comes from making decisions from fear. Today's conversation is about how to slow that process down, how to think clearly in a space that often pushes urgency, how to separate what you actually want from what you're being told you should want, and how to make choices that align with your face, your life, and your values, not trends and not pressure. This isn't about doing more. It's about understanding enough to choose well. And that, in our experience, is what helps women feel confident, not just in how they look, but more importantly, in the decisions that they make.
Well said. So I think the last thing we all want as physicians is for someone to do something, and as consultants and in this industry, for someone to do something and then regret it, right? So I think it is so important to kind of understand what's happening to your face as you age. So if you haven't had a chance to listen to our last episode, go back and listen to it, because I think it will give you a good framework for how the human face ages, what's normal, what's to expect. And when we're thinking about treatment choices and putting together a treatment plan, we're really looking at your face through that lens to really understand and help you understand, where is your biggest payoff going to be for your investment in time and money, right?
Absolutely.
So tell us a little bit about the consultation process, Amanda, and what you kind of talk to patients about.
I try not to talk as much as the patient, which is very hard for me, for those of you that know me. But my goal is really to help them find their voice and for them to be able to clearly state what they want to see if and when they decide to move forward with the treatment. Because to what you just said, the worst thing is if someone decides to have a treatment and then has regret over what they've done. So it's so important that we take the time and we have the ability to sort of coax things out of people to get a very clear picture of what would make them happy. And then using our experience of knowing what's possible with the tools that we have and what's appropriate, like, do those two things align? And then only when those two things feel like they're in alignment, do I think, am I excited about them making the decision to move forward with the treatment?
It's because it's really a journey you're taking together. You want them to have agency over the decisions and you want to be able to guide them. And it's not a one-stop shop. There's not just one treatment, and the treatment choice will evolve over time. And often there are treatments that are complementary to get the results. And what you see will change over time as well. It can be quite complex, and it can be quite hard to understand why one person is getting one treatment and then, especially if you have friends coming in together, they think they're going to get the same thing. And oftentimes when we assess them, they have two completely different treatment plans.
Like, did you not have 3 in your room last week?
I did. Yeah. They were all going on a holiday. we had conversations about their different concerns, and they were really intrigued as to how one treatment might be good for one person and not another person, and the subtleties involved in that. Those conversations
Yeah.
can sometimes get tricky because there's overlap when you're jumping from one person to the next. But
Oh,
Yeah.
100%.
they're
Yeah.
also, yeah, it must be quite enjoyable because you can see them kind of connecting the dots and being curious about their friend and, well, will that work for me and why not? And but yeah, that was a fun.
Yeah. Can be fun, right? And I do like it when people are open and transparent with their
Hmm.
friends as to what they're doing. So it's
Yeah.
great. But to your point, like it's not a one treatment fits all, and there's a good reason behind that, right? So in our last episode, we talked about how some people have a particular Achilles heel. They might have a short chin that ages them faster. Other people might have skin that tends to get mottled and wrinkled in a particular way, and so they might need a laser. Almost everyone can use some Botox. So
Mhm.
like it is quite unique, and you do have to assess each face. And I think a lot of times patients come in thinking that there's a magic wand, one wand that you
Mhm.
can use that's going to magically reverse or improve all these changes that they're seeing. And they might not understand that the end result of looking tired is actually because of skin changes, periorbital fat loss, as well as muscle overactivity and
Mhm.
wrinkles. So I don't have a make it less tired wand.
Yeah.
And I would say that we see it more often with lasers. Lasers are so mystical and magical, and a lot of times people think that just do the laser and that's it, but no, it is a cumulative thing. Like lasers work on skin, so we still need your Botox to stop the muscles from creasing your skin repetitively. You still probably have some volume loss that needs a little bit of fillers. You might have some significant collagen loss, which will be somewhat improved by lasers, but add in some bioregenerative treatments. So like you have to
Mhm.
understand what's going on in the face, right? And then the person has to understand that it's a journey, and it's one treatment, then the next, and the next. And when we look back at your pictures a year later, you see a tremendous change. But it wasn't just one thing that made it so, right?
No, no, it's usually a
Hmm.
cumulative effect and addressing the problem from different angles.
Totally.
And
Yeah.
one of the key factors is also gauging the comfort level with the procedures. Like I had someone
Yeah.
today that what is standing out to her. So she's doing the skincare. She's really happy with how glowy her skin looks, how her tone has improved. She's been someone who's been doing Botox regularly, and as someone that had come in with, that just feeling angry. And she'd said to me, I always thought I had very unique features growing up. And as I've gone older, those features are
Mm.
being hidden. And using
Oh,
Botox has been able to like open up and show those features. But she's like, now what I'm noticing is that around my eyes, the skin is just so thin. My makeup is
yeah.
getting harsh. And we often see that,
Right.
particularly the under eye skin. It is so thin. And in the neck as well, it's very similar, but
Hmm.
we don't tend to put foundation on our neck. So, and we ended up having a discussion about what's the best option. We talked about doing PRP injections under the skin, which
Yeah.
was liquid that'll contain essentially all the factors that your body needs to regenerate new skin, thicken the skin. We talked about radiofrequency microneedling, which stimulates the same process but a different way. And we were kind of weighing up the pros and cons, like, well, what kind of downtime can you expect? What kind of pain you might expect? And even at the end of the conversation, there was still a lot of, wondering which is going to be the best. Obviously, in an ideal world, I would do both in combination. But
Yeah.
um, that is, if someone has a fear of needles, you might not say, okay, let's do some radiofrequency microneedling because you're going to be getting
Mhm.
needles all over your face.
Yeah.
Whereas if it's
Yeah.
just a few pokes, it might be more, tolerable. So it's never um, one size fits all. Even for one problem, we'll have different tools we can use, and we need to gauge where that person
Mhm.
is at.
Yeah. And what they've got going on in their life, right? You had some people that were going away on a trip, so you're not going to want
Mhm.
to do treatments right before you leave somewhere. And then, depending on someone's lifestyle and their sort of tolerance for downtime, which is what you
Mhm.
were alluding to, right?
Mhm.
Um, and their psychology too. Sometimes we have people who are like, I've had enough of this. I've been looking in the mirror, noticing this forever, and I want it fixed like ASAP. And I will do 3 treatments the same day, but I don't want to have
Yeah.
to come back. Right.
Yeah.
So it's so variable. Yeah. So I mean, treatments can be really variable as to how you structure them when you're coming up with a treatment plan, right? You were mentioning that you had some ladies who were going away on a big trip. So we're not going to schedule big treatments right before you leave. It really also depends on the psychology of the patient. Like you were saying, if somebody's got a fear of needles and they are not going to resonate with radio frequency microneedling. And similarly, we do sometimes get patients who are like, I've been thinking about this forever. I have explored my options, and we'll discuss sort of aging with them. And they're like, I'm a busy professional. I have this 2-week time off of work right now, and I
Yeah.
want to do all the treatments that I can do to get me looking my best at that 2-week time period. So, in that scenario, we're going to sort of maybe bundle a laser, do their Botox at some point, do their fillers, and try to get them looking their best very quickly. And then we have other people who are very they really want to take their time, and they really don't want anybody to know that they're doing anything. And I would say that's more common. And as long as they're not emotionally at the point where they really need to see change right away, we can do so many things that are extremely subtle but cumulative and add up. And, within a year's time, you see remarkable changes in their skin and their volume. And,
Hmm.
in that category of treatments, I really love biostimulator treatment. So we see a lot of people doing Sculptra, a lot of people doing Radius,
Hmm.
as well as your other, traditional fillers still definitely have a place.
They do.
So, it's really, we really try to understand where you're at. And then it's so important to help you understand why things are changing and why are we picking one thing to focus on first?
Hmm.
And, usually when I look at that, I'm like trying to understand what is out of harmony. What looks older than the rest of the patient? Is it their skin looking older than their volume? Is it their lips and perioral area that's aging them disproportionately to their upper face? So these are some of the ways that we kind of look at it as professionals, and we try to help you understand it.
And oftentimes it can feel when you go into the settings or the aesthetic field that you're trying to be convinced to do more, and that's not our intention. And if you ever feel like that, it's okay to take a step back and think about things. Really,
Hmm.
our goal is to try to guide you so that you feel steady throughout the treatments that you choose, and you can understand what you're seeing in the mirror, and you can make a thoughtful decision about your treatment without jumping into something.
Hmm.
And if it's something that you're curious about and you want to understand what questions to ask, what treatments to explore, subscribe to this podcast where we have these types of conversations and we try to explore what's available and how to navigate your aesthetic and aging journey in a positive way. So, to all who
Hmm.
listened, we're very happy that you're here. Please subscribe
Yes.
or comment or send us an email, and we will chat to you soon.
Before we wrap up, just a quick reminder. While we're medical professionals, everything shared on the Beauty Equation is for informational purposes only and isn't intended as medical advice. This podcast doesn't establish a doctor-patient relationship, and any medical or aesthetic decision should always be made with a qualified healthcare provider. Our views are our own and don't necessarily reflect those of our employers or affiliated organizations. And remember, the field of aesthetics is always evolving, so information may change over time. See you next time on The Beauty Equation.
Thank you for tuning in today. If you enjoyed today's episode, don't forget to like, comment, and share it with someone who might need to hear it too. We'd love to hear your thoughts or questions. You can send us an email at info@thebeautyequation.com, and you might hear your question answered in future episodes. You can also find us on Instagram at Dr. Christelle MD, at H. Lotay MD, and at Crow's Feet and Confidence. Until next time, keep questioning the equation.